that has been done there, and then of course all the resources that we can dig a little bit deeper into after this conversation. So then lastly, for Dr. Roddy, would love to hear again your perspective on how you define health equity as a frontline provider, especially in the Miami area.
Hey, thanks, Lorraine. Great comments from the panel so far. I mean, in my opinion, health equity is really just equal access to services at affordable prices, right? I mean, so what I've seen as an emergency medicine physician is that you just have parts of the community that are underserved. It's not that the physicians aren't good. The physicians are great. The nurses are great. What you might see though is that the infrastructure of the facility might be underinvested in, right? So it's like, the materials that you would use to help these patients are outdated and, in dire need of an update. I will tell you that during COVID, you've seen a mass exodus of nurses from the nursing profession. Now, for generations, nurses have been underpaid in this country. And essentially, what's happened is that when you have a hotspot in COVID around the country, what that does is that drives up the nursing rate. And many of the local nurses will leave the community to go essentially chase higher paying contracts. Now, had they just been paid properly to begin with, we wouldn't be feeling this pressure. So what happens is that your support staff, the physicians are there, and some of the nurses are there, but the support staff that we need, a lot of these larger companies are not matching those rates. So what that means is that the patients that are here that need your help might not necessarily have the surrounding staff they need to be servicing them. And unfortunately, this happens, more in lower income communities. And as a medical director of our ER, I'm not involved with the budget of the hospital and how they're allocating capital. All I can really do is advise the hospital on what I think they should do. And unfortunately, many times during my career, I haven't seen the capital investments be placed in places where they're needed. And our hospital is actually going through a transformation right now where we're actually under new hospital leadership starting literally on Sunday. So everyone is excited about that, and I think that we're going to see some changes in capital allocation. But I mean, that's really the difficulty. I mean, I work at a hospital that serves an underserved community. It's an immigrant community. It's a primarily non-English speaking community, and people wonder where the funding is. I mean, because in the surrounding hospitals and some of the other areas, they don't have these challenges. So I would say that that is the main definition for me of health equity, making sure that everyone has access to services at an affordable rate on demand when needed. And secondarily, I think it was one of the panelists mentioned this. I mean, people really need to prioritize their personal health. I mean, if COVID, identified anything, it's that, certain communities have higher incidences of health concerns. And if a pandemic comes around, if a killer virus blows through, you're going to be at a higher risk for having a bad outcome. And so what I tell my patients in my one-on-one interactions with them is that, if you drink and do drugs, and smoking rates and drug usage rates are equal across all type of racial demographics in the United States, right? But if you do drink and do drugs and smoke at a time when there's a virus going through the world that could potentially suffocate you, I mean, that's not a smart decision. I mean, COVID identified that Americans need to be living their healthiest lives. You need to be prioritizing, healthy eating. You need to be prioritizing aerobic exercise. If you do smoke, that's a bad idea. You shouldn't be doing that. If you do drugs, don't do that. I mean, all of those things will increase the likelihood of you having a poor health outcome. So, I mean, to your colleagues here, being junior analysts or people that ultimately want to move the needle, as you've said, in the healthcare industry, any type of reform has to involve patient education and an advocacy for healthy lifestyles and aerobic exercise. Because if you're not doing that, I mean, changing policies on payer mixes and making services more available, I mean, none of that's actually going to drive down the cost of healthcare. The only thing that will do that is if people actually live healthier lives. Because a lot of these things that we see, cancers, some of these other health conditions that aren't, genetic, are highly related to lifestyle and diet. And if we just prioritize those things, you'll see a revolution of healthcare in this country. And if I was in you all's positions, if you truly want to be leaders, this is the messaging that you need. This is not what you're hearing on television. This is not what you're hearing from the politicians. And all of the healthcare debate, did you ever hear anyone really talk about prioritizing healthy lifestyles and prioritizing aerobic exercise? I mean, that's not really at the forefront of the debate. So I would recommend that to you all. And this is something that I bring to my patients on a daily basis here out of the emergency department.
Well, thank you, Dr. Roddy.